Welcome to this explainer. If you're navigating fertility care right now, I just want to take a second to warmly welcome you. Today, we're completely tossing out the complex clinical jargon to create a safe, supportive space to talk about your tubal health assessment. We're going to walk through the whole thing step by step so you can feel completely informed, prepared, and, honestly, just entirely at ease.
You know, the fertility journey is incredibly unique for everyone, but one universal truth is that it can absolutely feel overwhelming sometimes, right? There are so many acronyms, so many tests, and all these new experiences thrown at you at once. If you've been feeling even a little bit anxious about what comes next, please know that your feelings are completely valid. But I also want to reassure you, we are here to walk through this together. Today, we're going to answer exactly what you can expect from a tubal health assessment. We're going to shed some light on the unknown so it simply becomes the known.
Okay, let's dive into this. At its core, this assessment is really just a gentle step forward to gather more information. Think of it as a way for your care team to quietly listen to what your body is trying to tell them. You are not taking a test you can pass or fail, so take that pressure right off your shoulders. You're simply utilizing a tool to help us understand your reproductive health just a little bit better. By bringing this vital information into the light, you and your medical team can make the absolute best, most personalized decisions for your family-building goals. Section 1. Understanding fallopian tube health. To kick things off, let's look at the specific, modern test recommended to evaluate your tubal health today. Your fallopian tubes play an absolutely crucial role in conception. They act as the physical pathway where the egg and sperm actually meet, so evaluating their health is pretty much a cornerstone of fertility care. Now, you're likely going to hear two very specific, kind of intimidating clinical terms, HyCoSy and HyFoSy. Let's completely demystify these right now. Yes, they stand for Hysterosalpingo-Contrast-Sonography and Hysterosalpingo-Foam sonography. But listen, you do not need to memorize that. What you really need to know is that these are simply non-invasive ultrasound-based tests. Instead of using older, harsher methods, they use a super safe contrast media, specifically a really gentle foam gel to check your fallopian tubes. They're incredibly safe, and they literally just allow your doctor to see inside your body in real time using standard ultrasound technology.
So you might be wondering, why is this specific test being recommended for me right now? Well, in the structured world of fertility evaluation, a HyCoSy or HyFoSy test is usually recommended for investigating subfertility once the male factor has been entirely excluded. It's just a very logical, step-by-step approach. Once your doctors have confirmed that male fertility factors aren't the primary hurdle, examining those fallopian tubes is the most helpful next step to ensure that the pathway for conception is wide open.
Now, what's really interesting about this slide is the word patent. This is a term your doctor is definitely going to use, and honestly, it's a fantastic word to hear. In medicine, when we say the fallopian tubes are patent, it simply means they are completely open and clear. It's like a clear highway. During the test, the doctor watches the monitor. When that safe foam gel is injected, they're basically just looking to see it spilling easily on both sides right around the ovaries. If they see that beautiful, easy spillage, your tubes are patent. Knowing exactly what a positive result looks like really helps take the mystery and the anxiety right out of the process.
Section 2. Timing your procedure perfectly.
Timing is literally everything when it comes to reproductive health. And the great news here is that this test has a very specific, highly manageable window. Knowing when things are supposed to happen really helps you feel prepared and totally in control of your own schedule. This timeline shows how easily this test actually fits right into your natural menstrual cycle. Everything is anchored to day 1, which is just the very first day of your period. For the first few days, you're simply resting. Then we look for the ideal window for the test, days 5 through 11 of your cycle. It's best done during this specific time frame, after your period is mostly wrapped up, but right before you ovulate. It's a very predictable window, which makes scheduling your appointment incredibly straightforward and totally stress-free.
Section 3. Step-by-step, the test.
Okay, now we've reached the part that often causes the most anxiety, the procedure itself. I promise to explain it clearly, gently, and without any of that intimidating medical jargon. Just think of me as your personal care coordinator, holding your hand and letting you know exactly what's going to happen when you step into that room. Before we even break down the steps, I really want you to focus on this number, 10 to 15. That is the number of minutes it usually takes to complete the entire procedure. It is remarkably quick. For a test that provides such profound, actionable insights into your fertility, you'll literally only be on the examination table for 10 to 15 minutes. Hopefully, just knowing how incredibly brief this whole thing is brings you some immediate, genuine relief. So here's exactly what happens during those 10 to 15 minutes. Step 1 is an initial transvaginal scan. This is just a standard routine ultrasound to quietly assess your pelvic anatomy. For step 2, a speculum is placed in the vagina, very much like your routine pap smear, and the cervix is gently cleaned. In step 3, a very fine sterile plastic catheter is carefully placed into the uterine cavity. And please notice the word fine there. We're talking about a super thin, delicate little tube designed specifically for your comfort. Finally, step 4 is where the real magic happens. The foam gel is gently injected through that fine catheter, and a transvaginal ultrasound tracks the gel in real time, just watching it flow and looking for that beautiful spillage we talked about a minute ago.
I want to pause here for a second and read you a direct quote straight from the medical literature regarding this test. Usually, the procedure is well tolerated and no painkillers are necessary. I really want this to serve as a powerful reassurance anchor for you today. While absolutely any medical procedure can cause a little flutter of nerves, that's just human nature. Clinically speaking, your body can handle this safely and comfortably without the need for intense medication.
Section 4. Gentle benefits and advantages.
Now, you might be wondering why fertility clinics offer this specific method instead of some of the older tests you might have stumbled across on Google. Let's look at the incredible patient-first benefits that come with this choice. And this brilliantly illustrates the difference between the past and the present of fertility testing. Historically, the traditional method was something called the HSG test, which actually required X-ray radiation and an iodated contrast dye. But today we have the HyCoSy and HyFoSy tests. These are modern ultrasound methods that use, say, foam gel, meaning absolutely no X-ray radiation is involved at all. It is a massive leap forward in making fertility care so much gentler and safer for you.
Because we're entirely skipping that older X-ray method, you get a whole host of additional benefits. First off, it completely avoids any risks of iodine allergies, since no iodated contrast is used. Second, the HyFoSy foam gel is widely known to be much less uncomfortable, producing far less irritation than the fluid used in those old HSG tests. And finally, because your doctor is using a dynamic, real-time ultrasound, they get the wonderful bonus of assessing your other pelvic structures at the exact same time. It's basically a comprehensive look at your overall pelvic health without any unnecessary discomfort. A real game changer.
Which brings us to our final thought for today. Are you ready to take this empowering, gentle next step in your fertility journey? Gathering this knowledge is such a beautiful, positive stride toward your family-building goals. You now know what HyCoSy and HyFoSy actually mean. You know the whole thing takes just 10 to 15 minutes, and you know it's a modern, super safe procedure designed specifically with your comfort in mind. Knowledge truly is power, isn't it? So, as you think about scheduling your next appointment, ask yourself, how does it feel to step out of the unknown and finally take control of your fertility story with confidence? Thank you so much for exploring this with us today.